Have you ever stopped to think about how we get that very first picture of life? I mean, it's incredible, right? Well, today, we're going to open that remarkable window into the womb. We're going on a journey, trimester by trimester, to see how simple sound waves can paint this super intricate picture of development right from the very, very beginning. So, how in the world is it possible to see something so tiny, so completely hidden from view? The answer is just amazing. It's high-frequency sound waves. They literally paint a picture of a world we would otherwise never get to witness. This technology gives us our very first introduction to a new life. And, it all starts with just confirming the most basic facts. All right, let's start at the beginning, that first trimester scan. It's fundamental. This is that moment of confirmation where you get the first real evidence of a pregnancy. And, just as important, it's where we establish a timeline that's going to guide all the care from here on out. And things happen so fast. What's really amazing is just how quickly these key structures show up. In these super early stages, doctors often use what's called transvaginal sonography. It just gives a much clearer picture to see that gestational sac at only 5 weeks. Then, just a half week later, bam, the yolk sac pops into view. And by 6 weeks, we can often see the fetal pole. That's the first visible sign of the embryo, and even detect that all-important tiny flicker of a heartbeat.
The key thing here is accuracy. Sure, a last menstrual period can give a rough idea, but it can be off by weeks. Ultrasound in the first trimester, though, that is the gold standard for dating a pregnancy. We're talking an accuracy of just a few days, and that kind of precision is absolutely vital for making sure development is on the right track.
So how do they do it? Well, what you're seeing here is the key measurement. From the top of the embryo's head down to its little bottom, technicians measure what's called the crown rump length, or CRL for short. In these early stages, growth is so predictable that this one single measurement is the most accurate way there is to figure out the baby's gestational age and that all-important due date. But hold on. Before the dating, before counting anything, there's one question that has to be answered right away, and it is all about location. Where exactly did the embryo decide to set up shop?
And this is a really critical safety check. An intrauterine pregnancy, that means inside the uterus, is the normal, safe place for a baby to grow. An ectopic pregnancy, on the other hand, means it's implanted somewhere else, usually a fallopian tube. That's a serious medical emergency, so making sure the pregnancy is in the right place is, without a doubt, a top priority of that first scan.
So you can see that first visit is just packed with information. We're confirming that tiny heartbeat, figuring out if it's one baby or maybe more, doing some early screening checks, and even taking a look at the mother's uterus and ovaries to make sure everything looks healthy. It's so much more than just taking a picture. Okay, let's move into the second trimester because this is where the picture gets much, much clearer. This is the scan most people think of, the detailed anatomy scan. You can think of it as a super meticulous head-to-toe examination of the baby. It usually happens right around the halfway point of the pregnancy, maybe between 18 and 20 weeks. And the whole point of this scan is to systematically check on the baby's physical development, making sure all the organs and all the different structures are forming just like they should be. And when I say detailed, I mean the checklist is incredibly thorough. I mean, look at this. Sonographers are looking at everything. The chambers of the heart, the structures of the brain, the stomach, the kidneys. They trace the entire spine from top to bottom, and they even count the arms, legs, hands, and feet. It's amazing. To do all this, they take a whole series of really precise measurements. What you're looking at here is a key one, called the biparietal diameter, or BPD. It's basically a measurement from one side of the baby's head to the other. And by comparing this to standard growth charts, doctors can confirm that the baby is growing right on schedule. Then, they'll also measure the abdominal circumference, or AC, like you see here. This measurement is super important for keeping an eye on the baby's weight and making sure all those internal organs have enough room to grow. Put all these data points together and you get a really detailed picture of how the baby is doing. All right, as we head into the home stretch, the whole purpose of the ultrasound shifts again. In the third trimester, it's less about that initial discovery and a lot more about surveillance, basically monitoring the baby's well-being as they get ready for birth. So the big question is, as the due date gets closer, how do we make sure the baby is still growing well and getting everything it needs from the placenta? Answering that is exactly what third trimester ultrasounds are for. One of the main things doctors are looking for is related to this number, the 10th percentile. So what does that actually mean? Well, It relates to a condition called fetal growth restriction, or FGR. This is when a baby's estimated weight falls below the 10th percentile for its age. To put it simply, it means the baby is smaller than 90% of other babies at the exact same stage. And spotting this is really important because it can be a sign that the baby isn't getting enough oxygen or nutrients.
So these later scans are all about keeping a close watch. They're tracking growth on charts, checking where the placenta is to make sure it's not in the way for delivery, and they can even use these advanced techniques like Doppler ultrasound. Now this is really cool. This special ultrasound doesn't just create an image, it actually measures the flow of blood. By checking blood flow in the umbilical cord and in the baby's brain, doctors get a direct look at how well the placenta is working and how the baby is coping.
So, as we've seen, this incredible technology really tells a story in 3 acts. It takes us from a tiny, blurry sac to a fully formed baby, and the role of the ultrasound just evolves, serving a totally distinct and vital purpose at every single stage of the journey.
It really just boils down to this simple progression. The first trimester is all about confirming the pregnancy and setting the clock. The second trimester is for that deep dive into anatomy, assessing how everything's developing, and screening for issues. And finally, the third trimester is all about monitoring growth and getting ready for a safe arrival.
When you step back and think about it, it's just an incredible piece of technology. It transforms what was once a total mystery into a series of visible, measurable milestones. It gives doctors vital information, and for parents-to-be, it provides this profound, reassuring connection.
And that leaves us with a really fascinating question for the future. With technology like 3D, 4D, and even more advanced imaging coming down the pike, what other new windows are we going to open into these first 9 months? It's a pretty exciting thought to end on. Thanks for joining me on this journey.